In this ECGenius lesson, we'll be looking at the physiological electrical activity of the heart and why that gives us the tracing that we see in lead 2. So if we recall, lead 2 is formed by using our right arm electrode as the reference electrode and using the left leg electrode as the reading electrode. When the heart is at rest, there is no electrical activity. So, from the point of view of this electrode down here, there is no flow or no depolarizations. So we have a flat tracing on our EKG. The electrical activity originates in a normal heart in the SA node up here. From the SA node, you have depolarization that goes across the atria using 3 different pathways to get to the AV node. And then you have a 4th pathway called the Bachmann's bundle, which depolarizes the left atrium. From the point of view of this electrode down here, these waves of depolarization are moving towards it. So that would give us a positive deflection on EKG. And so here we have our P wave. After the depolarization gets to the AV node, there's a little bit of a pause to allow filling of the ventricles. Since there's no electrical activity during this pause, we get another flat tracing on the EKG. After the AV node, you have it break down into the left and right bundles. So you're going to have one bundle going down here, and your right bundle going down this way. Now, an important physiological aspect of the heart is that the interventricular septum is depolarized by the left bundle branch. And the direction of depolarization is going to be like this arrow here. So it'll depolarize from the left bundle branch up in this direction. So from the point of view of our electrode down here, the depolarization of the septum is moving away from it, which will give us a negative deflection and our Q wave. After the Q wave, you start to get depolarization of the ventricles. In a normal heart, the left ventricle is much more massive than the right. So most of the depolarization is going to be related to the left ventricle. So we have depolarization that proceeds from the inside out of the ventricle. And again, since the left one's greater, we're focusing on that one. And all of this depolarization is moving towards our electrode, giving us the positive R wave in lead 2. Then, as depolarization proceeds, it starts to go up the Purkinje fibers in this direction, which moves us away from the left electrode, giving us a slight negative depolarization in our S wave. And then we have complete depolarization of the ventricles, so there is another pause in electrical activity, giving us our flat tracing here. And finally, we will have repolarization of the ventricles. Repolarization moves from the outside inward, so opposite of depolarization, so occurring in this direction, which is away from our reading electrode. However, we can think of repolarization as being the inverse of depolarization. So even though we're moving away from the electrode, in this case, we're going to get a positive wave on our EKG since it's repolarizing, giving us the T wave that we commonly see. And then after this, the cycle would repeat itself. So let's take an example of a pathologic condition that we can better understand having gone through lead 2 here. In a patient who has hypertrophic cardiomyopathy, or HCM, they have abnormal thickening of the interventricular septum. So in a patient with HCM, the normal depolarization of the septum would be greater in magnitude, since there is more tissue that needs to be depolarized. So on an EKG tracing, we also have our normal P wave, but then once we get to the Q wave, which is our septal depolarization, since there's more depolarization going on, we're going to get a deeper Q wave of greater negative amplitude prior to going back to our normal R, S, and T. So here's our Q wave, normal R, and normal S. So in a patient with HCM, on an EKG, you may sometimes see what is called a dagger-like Q wave. So you have a Q wave that's of greater amplitude, but it is still narrow and it's not widened. And this is due to the greater amount of depolarization going on in the interventricular septum. So hopefully this video gives you a better understanding of how the direction of the electrical activity of the heart gives us the different EKG tracings we see in the various leads.